Some acute illnesses, such as respiratory infections or gout, can bypass the doctor's surgery and go straight to community pharmacies. Scotland is aiming to deliver a similar service, but by contrast, England is yet to adopt this approach. Our health editor, Hugh Pym, reports now from the Welsh city of Newport.
Can you just open your mouth, Jack? We'll have a look at your tonsils.
Jack has tonsillitis. He's being examined by Jonathan. But this isn't a GP surgery, it's a pharmacy in Newport. Jonathan is trained to prescribe medication as well as being a pharmacist.
You take 1 or 2 up to 4 times a day.
He's given painkillers to Jack, which means there's no need to go to a GP.
I think it's brilliant. I think it will help a lot of people because GPs are quite hard to get into at the moment, so probably relieve a little bit of the pressure off them.
I spent years referring people to the GP for conditions that I knew that I could treat myself, and now I'm in the position that I can do that. Patients have much better access to care, and the added benefit then is you know that you are freeing up GP appointments for more complicated patients.
Local GP practices are reaping the benefits.
Have we referred any patients to the pharmacy today?
This surgery refers around 25 minor ailment patients each week to the pharmacist. That's 100 GP appointments saved each month, and more time for doctors to visit seriously ill patients in their homes.
We are finding that demand is outweighing capacity, and so anything that relieves some of the pressure on general practice is very welcome.
At times, some medicines are in short supply. Right now there are stock problems with hormone replacement therapy, HRT, which can lead to distressing delays for women needing repeat prescriptions.
When you think about, for example, the shortages and the HRT issues that we're currently facing, having a pharmacist prescriber being able to prescribe alternative medicines without the patient having to wait to see the GP is a great thing for the patient.
Health professionals in local communities agree this is an important move towards improved services, but it'll take time. And the bigger picture right now is that there are significant stresses across ambulance services, hospitals and the wider NHS, here in Wales and across the UK.
It's bad everywhere, really. The wards are full. That means there's pressure on the A&Es, which means that people can't even get into a treatment room. They're often being treated on trolleys. And the ambulance people are looking after acutely ill patients in car parks.
The Welsh Government says staff sickness in the NHS has added to the pressures. Unlocking the potential of highly skilled health staff is important, but only part of the solution. Hugh Pym, BBC News, Newport.